Title: Death Metrics Madness. Are hospitals shifting to end-of-life care too soon for their own good? TLDR. Claims emerged that HCA Healthcare is pressing its staff to urge patients' families towards initiating end-of-life care too soon. While this could potentially cut back on mortality rates and in-hospital stays, it's causing some serious eyebrow-raising. In the latest wave of hospital drama, whispers have reached our ears that something's afoot within HCA Healthcare's walls. The reports suggest an unnerving trend. Apparently, there's pressure from the powers that be for staff to nudge patients' families towards initiating end-of-life care sooner than might be necessary. What's behind this push? Theories point to a potential focus on metrics. The earlier shift to end-of-life care might help shrink those pesky in-hospital mortality rates and lengths of stay. While those numbers might look pretty on paper, we have to ask, what's the human cost here? And how does this affect patients' chances at pulling through? Based on interviews with clinicians currently or previously engaged with 16 HCA hospitals in 7 states, this issue seems to be quite widespread. According to these healthcare professionals, the drive towards palliative and hospice care is mainly about beautifying quality or operational measures. It's all about painting a better picture of in-hospital mortality rates, readmissions, and length of stay. Let's dive a little deeper. HCA Healthcare, based in Nashville, Tennessee, operates a whopping 184 hospitals across 21 states and even across the pond in the United Kingdom. Among the measures that the organization keeps an eye on, the in-hospital mortality rate is one of the top 10. So, if these allegations hold water, we're looking at a system that potentially incentivizes quicker end-of-life care to buff up those numbers. But, hey, what about the patient's perspective in all this? The last time we checked, hospitals were about saving lives, not just meeting metrics, right? Now, hold up. We're not here to throw shade, just to share the tea that's been spilled. The allegations are serious, no doubt, but they're just that, allegations. So, how does this affect the faith we put in our healthcare system? We're all for transparency and improved metrics, but not if it's at the expense of life-saving treatment. All right, folks, time to hit you with the big question, and we want to hear your thoughts. Is the race for better metrics undermining patient care, or is this just a misunderstood strategy? And more importantly, where do we draw the line between quality healthcare and corporate objectives? Disclaimer: this article is not intended to give healthcare or legal advice. All the information, content, and material is for informational purposes only. For healthcare or legal advice, please consult with an appropriate professional. The views expressed here are just those of the author and do not represent those of Turned Up News.